Hi, good afternoon. Welcome to Tuesday Reading Live. This is me, Vandana, joining you from 𝐻𝐄 Academy. Okay, so how was your weekend? Okay, so as usual, we will start with a sample question from part B. Then we will move to the important part, which is part A. So I'll give you 2 minutes for the question. Then we will discuss the answer. So here comes the question. Alright, so welcome back. So have you all done the question? Okay, so this is a sample question which gives you an idea regarding the second category, that is from a manual category. Okay, so same like on the previous day, what is a manual? Manual, which means something, okay, a booklet which regarding all the information regarding a particular machine, instrument, device, equipment, or a medicine. Okay, so this is all about subcutaneous cannula. So what is the question? The main point of the extract on subcutaneous cannula is to explain something. So this question is incomplete. And when you read a question, always connect your answer. Okay, so the first option, the versatility of their design and function. Then second one, that they must only be used by registered nurses. And option C, the need for a backup cannula in case of malfunction. So what is the correct answer here? Any idea? Can you comment it? Okay. Yes, Reba, Megha, Kavita. Okay, Reshma. Good afternoon. Yes. Okay, so let me know what is your answer here. What is your answer for this particular sample question? Whether it is A, B, or C. Okay, so coming to this question. Okay, a lot of answers. Alright, so let's check what is the correct answer here. So first of all, when you read a question, as usual, you can mark some keywords from the question. So what are the keywords from the question? So here, I am marking the keywords subcutaneous cannula explain. So these three are my keywords from the question. Okay, so once again I'm repeating the same thing. This is all about, this is a manual, so this is all about a function or a proper idea regarding a particular machine, instrument, device or a medicine. So here comes a device or a equipment. Then the versatility which means what I can say, that ability to adapt something. So that is versatility of their design and function. And option B, that they must only be used by. So keywords from option A, versatility, design, function, and from option B, only, used, nurses, and from option C, need, backup, malfunction. So these are my keywords. Okay. Hi Sobi, good afternoon. How are you, dear? Okay, so happy to see you here. Yes, so I'm just moving to the paragraph. Subcutaneous cannula. A subcutaneous cannula is a small plastic tube designed to carry medication into a person's body. So as you know, second category is always about manual and policy. So manual and policy, whether it is a manual or policy, the first three lines are always important, and you know that, right? So what is in the first line? I'm not saying that first line is always the correct answer, but the first line will always, the first three lines will always give you a clue towards your answer. Okay, so subcutaneous cannula, that is the keyword from the question, is a small plastic tube. So that means it shows that ability of this particular instrument to do something, right? So plastic tube designed to carry medication into a person's body. So that is all about its design. So I'm tracing my answer towards option A. Maybe, I have no idea. Then reading the rest of the lines. One end inserted by the registered nurse. Okay, so not mentioned regarding it is only used by a registered nurse. Yes, one end is inserted by a registered nurse, sits just under the person's skin. The other end divides into two parts shaped like Y. So what is the design here? It is shaped like Y. Then one part of the Y arm can be connected to a syringe driver or infusion pump. The other can be used for subcutaneous injections. The nurse may insert, again nothing mentioned about it is only used by the nurse. The nurse may be inserting a second cannula in a different part of the body. This is in case the original cannula stops working and ensures that there will be no delay in giving medications to the person you are caring for. Then it can be especially useful if the original cannula stops working at night when nurses may not readily available or have the same level of support as during the day. Okay, so question is clearly asking you regarding subcutaneous cannula, so that we can easily eliminate option C, that is not mentioned anywhere in the paragraph, and question is not about the backup thing, it's all about this particular thing. Okay, so I'm eliminating not mentioned. So what about option B? They must only be used. Okay, so one reason it is not mentioned, but I'm just marking it as a contradictory or opposite option because it is not only be, maybe used by a nurse. Okay, so answer is option A. What is option A? The versatility, the ability to adapt what? The design and function. So it's all about its design and function. So answer is option A. And let me check. Okay. Okay. So the correct answers, I think, yes, Megha, Reba, Kavita, okay, Sabida Prasad, Reshma Sajiv, okay, Subi, yes. So that's all about this particular answer. So now we are moving to the important part, which is part A from the reading module. But before that, let me condense everything regarding part B. Okay, so in part B, we have exactly 6 questions. Okay, and these questions will be in the form of multiple choice questions with 3 answer options. Okay, so I can give you some probabilities of answers. One option will be not mentioned. One option will be contradictory option or will be opposite option. And you will have the correct answer. So these are the probability of answers, right? Okay, and what about the time? As you know, it's all about maximum. You can take 12 minutes. Okay, for part B. And 6 questions, multiple choice questions. What is the strategy that we are using here? We are using the strategy which is called elimination method. So let's move to the new topic, that is from part A. So here comes. Okay, so this is the material tetanus. Okay. Yes, Reba. So you got the correct answer, right? Okay, dear. Okay, so what about part A? So today, let's read the question and let's find out the answers. Then we will discuss about the time, then questions, then the strategy, everything. Okay. So now tell me, what is your answer for the first question? Or else you can comment what are the keywords from the question. So yes, what are the keywords from the question? First one. Let me know in the comments what are your keywords from the question. And as you know, when you read a question, it is important you have to mark the keywords in maximum 3. Okay, so what are the keywords from the question, Megha? You got the correct answer, dear. So what are the keywords? What are your keywords from the question? Yes. So the first question is all about what all proceedings are taken to get rid of the source of bacteria. Okay, so my keywords from the question, maximum 3, right? So, okay, so proceedings, then get rid as well as source. So these are my 3 keywords from the question. Okay, Reshma, your keywords, proceedings, get rid, bacteria, very good. Okay, Reba, get rid, source, bacteria. Okay, Jiva, it is source, bacteria, very good. And Kartika, it is get rid. Okay, Megha, all proceedings, source, bacteria. Okay, Kavita, proceedings, get rid, bacteria. Okay, so what about your answer? Proceedings, all the methods or the treatments that can be connected to kill the bacteria, to get rid of the bacteria. So what is the correct answer? So the treatment measures, which is mentioned as you can see here in text D, treatment of tetanus. So all the methods, all the medication that you can use, which is mentioned here in text D. So answer should be from D. Very good. A lot of correct answers. Yes, Tindu, Kartika, Kavita. Okay, Reshma. Yes, Reba, you got the correct answer. Excellent. Then coming to the second question. So what is second question? The predictable habitat of Clostridium tetani. So my keywords, predictable, habitat and Clostridium. So what about you? What are your keywords? See, it's not compulsory that you have to mark this name of this bacteria. It's up to you. Even if you can mark predictable and habitat, that's fine. Okay, Reshma, your answer is correct. But before that, let me know what are your keywords. Okay, Megha, predictable and Clostridium tetani. Very good. Okay, so those are the keywords. Very good. So about this particular bacteria which is mentioned here, as you can see from text A, the second paragraph, the bacterium that causes tetanus is called Clostridium tetani. The bacterium can survive, so that habitat, okay, of the bacteria, and of course that is from A, text A. Okay, Reshma, habitat and tetani, right? Okay, Kavita, predictable, Clostridium. Okay, so let me know your answers. Okay, Reshma, Reba, Rijo, Megha, Tintu, Kavita. Okay, Reba, Lijo. Yes, it is A, text A. Very good. Okay, Sarah, it is from text A. Very good, dear. Okay, then third question. What do you connote by aspiration bacteria? So what do you mean by connote? What do you connote? Which means very simple. What do you mean? Okay, so connotation, which means the meaning. So what do you connote by aspiration bacteria? So instead of bacteria, they have mentioned something else in the paragraph. I think it is pneumonia. Okay, so connote, aspiration, bacteria. These are my keywords from the question. Okay, see Megha, it's not cannot. It is actually a single word. It's not cannot, okay. It is connote. Connote, which means meaning. Okay. Okay, it is... Yeah, so it is from text C. Okay, Betty, very good. Your answer is correct. Second question, it is text A. Yeah, what about third one? What is your answer, Betty? Third question. Okay, so the connotation of aspiration bacteria, which is mentioned in text C inside the complications. So what are the complications mentioned? Breathing problems will be there, blockage of lung artery, yeah, those kind of problems, as well as pneumonia. So why pneumonia is happening? Because of this particular bacteria, virus or something. So in the bracket, aspiration pneumonia is mentioned. which means aspiration can happen or pneumonia can happen due to a particular virus. Okay, so that answer of bacteria. So of course answer is text C. Very good. Okay, Alina. Okay, Reba, Tintu, Betty. Okay, those are your keywords, right, Tintu? Okay, aspiration and bacteria. Very good. Okay, yes, so that is from text C. Kavita, yes, Reshma, Sarah. Very good, correct answers. Then fourth question. Administration or management, treatment of breathing difficulties associated with tetanus. So when you see this breathing difficulty, majority of the time we have that tendency to mark text C, but it is not from text C. They are not asking you regarding the symptoms, it's all about the treatment, administration. So administration, then difficulties, tetanus. See, these are my keywords from this particular question, and I got that answer. Okay, again, without even looking, I can tell it is from text D because it's all about the treatment of tetanus. Okay, so breathing difficulty, it is one of the cause for tetanus. So now I know the treatment, administration is mentioned here in text D. So my answer should be D. What about you guys? Very good. The last point from text D. Okay. Yes, Monisha Sharath. Yes, it is text D. Tindu Thomas, Megha Charles, Reba Rijo. Yes, Reba Lijo, it is text D. Kavita Balaji. Yes, text D. Okay, Kavita, your keywords, administration, breathing difficulties, associated. See dear, you don't have to mark more than 3 keywords. Okay, it is fine. You can mark, okay, 3. That's enough. Not more than that. So administration, difficulty, tetanus, or you can mark administration, breathing, associated. It's up to you, but maximum 3. Okay, Alina, it is D. Kartika, okay, yeah, right answers. Very good. Then fifth one, the typical signs and symptoms of tetanus. So what are the important signs and symptoms of tetanus? Okay, so or typical has different meanings in different contexts. So here, which means common. Okay, typical, which means common. In a medical context, we can say here in this particular material, typical, which means that can be associated with common signs and symptoms of tetanus. Okay, so typical, then signs, okay, symptoms. So these are my keywords. And yeah, where is it mentioned? Typical signs and symptoms. Okay, any idea which is the correct answer? Which text? Signs and symptoms. Okay, a lot of correct answers, and I'm so happy to see here. Okay, Reshma, Reba, Megha, Tintu, Monisha, Kartika. Okay, Kavita, it is typical signs, symptoms. Very good dear. Now it's correct. Okay. Yes, Kavita, it is B. Okay, Alina. Okay, Reba, Lijo, it is B. Very good. It is from text B. Okay, and I have a request you, because I'm just requesting you, please do comment your answers. Okay, because if it is wrong, I can correct you. So those who are watching this live, please comment your answers here. If there is any doubt or if you need any clarifications, I can correct you. Okay. Yeah, so that is fifth question, which is from text B. Okay, why it is B? See, the heading itself, signs and symptoms. So very easy, it is from text B. Then sixth one, factors that heighten the risk of tetanus infection. So heighten, which means not that height, it is increase. Okay, so factors, heighten, risk. So these are my keywords from sixth question. So what do you mean by heighten? Yes, increase. Yeah, so what about sixth one? Any correct answers? Let me see. Okay, Megha, yes. So it is good. Okay, because question number 6, your answer is from text A, and you have mentioned your keywords here, factor, heightened risk, exactly. Okay, if you're commenting like this, it will be better, because you will get an idea, okay, this is from this particular text, and answer is this, question number plus your keywords. Really good. Okay. Okay, Reba, yes, praise, it is text A. Kavita, Reba, Lijo, Monisha, yes, it is from text A. Okay, so why it is text A? Okay, see, direct answer, other factors that increase, heighten the risk of the condition. So that is from text A. Okay, so now the last one, how does tetanus lead to death? So my keywords, lead and death. So these are my keywords. So what are your keywords? May I know? Okay, Betty, it is text A, right? Yeah. So fifth one is actually typical signs and symptoms. That is from text B. So what about sixth one? Sixth one. Factors that heighten the risk of tetanus infection. Yes, it is right. It is from text A. So what about seventh one? Okay, how does tetanus lead to death? Okay, Riba, tetanus lead death. So those are your keywords. Very good, fine. Okay, Monisha, question number 7, C, lead death. Very good. Okay, okay, Tindu, C, it is lead death. Okay, Kavita, answer is C, correct. Tetanus death. Okay, Reshma, Kavita. Okay, tetanus lead death. Okay, Riba. Very good, Gina. It is from text C. So answer should be C. And where is it mentioned in text C? C. Last one, death. Okay, so death from tetanus is often caused by blocked airway during spasms and or damage to the nerves that regulate breathing, heart rate or other functions. Yeah, organ functions. Okay, so that is from C. Very good. So may I know how many of you got 7 out of 7? Okay, Adra, very good dear, correct answer. It is from text C. So anyone with 7 out of 7 for the first set of questions? Yes, Kartika, tetanus lead death, and your answer is correct. Very good, exactly. C. Okay, Kavita, you got 7 out of 7. Okay, Mega, 7. Okay, Reshma, Sajjiv, 7. Okay, Riba, it is 7. So happy? Very good. Okay, then second set of question. Okay, Mega, very good, 7. Okay, so now we are moving to the second set of question, 8 to 14, which are short answer questions. Okay. Zina, okay, Zina, 7, very good. Okay, so what about the first one? What are the keywords? Okay, before that, let me remind you once again, important thing, you can answer it in a word or a, okay, something has happened in between. Yeah, so you can answer in a word or a short phrase. Okay. Yes, word or a short phrase. So what do you mean by short phrase? Phrase which means combination of words. It can be 5, 6 or 7 words, whatever. But here, short phrase which means maximum 3, not more than that. Okay, so first one, 8th one. Okay, 8th one, the antibiotic employed to destroy bacteria in the nervous system. So antibiotic, which means we can relate with the treatment. So treatment is mentioned in text D, right? Okay, so what about the answer? So what are your keywords before that? Let me know. 8th question, your keywords and tell me your answer. Okay. Okay, Reba, Lijo and Kartika, you also got 7 out of 7. Very good, guys. Yes. So keep on trying, okay? So yeah. Okay, Mega, 8th one, penicillin is your answer, and keywords antibiotic, employed, destroyed. Okay. So antibiotic, employed, destroy, and I'm just marking those keywords. Okay, so answer is penicillin. Okay, Tindu, penicillin. Okay, Kavita, it is penicillin. Yes, Reshma, yes, Monisha, and your keywords antibiotic, destroy, nervous system. See, okay. So actually antibiotic destroy nervous system, which means 4 keywords. So as I mentioned earlier, it's maximum 3. That's enough. Okay. Yeah. Then okay, Reshma, antibiotics destroy nervous. Fine. Okay, Gina, answer is penicillin. Okay. So I'm going with your answer. Answer is correct, which is penicillin. From text D. Already treatment is here. So which is penicillin. That is the antibiotic mentioned. Okay, antibiotics, penicillin, it is to destroy the bacteria, which means to kill the bacteria. So that is penicillin. Okay. Yeah. So that is penicillin from text D. So which bullet point? Actually second bullet point, which is penicillin. Yes. So answer is penicillin. Okay, so answer should be penicillin. And I'm moving to the 9th question. Yeah, what about the 9th one? Then tell me, what are your keywords from the 9th one? Any idea? It is a very lengthier question, but still maybe easy. So what are the keywords? Maximum 3, okay? so important 3 keywords you can mark, and now tell me what are your keywords from 9th question. Okay, Betty, penicillin is the correct answer for 8th question. Yes. Generalized spams. Okay. Okay, so which means answer is generalized spams. Okay, so keywords seizure, several minutes. Okay, Mega, answer is generalized spam. Repeated progression, several minutes. Okay, repeated seizure, several minutes. Okay, generalized spams. Okay, Tintu. Okay, Adira. Generalized spam. Okay, Monisha, generalized spam, painful progression, several. Okay, Riba, generalized spam. Very good. Answer is correct. Okay, generalized spams should be the correct answer. And here, what are the keywords? I'm just marking seizure, then progression, as well as minutes. These are only my keywords from 9th question. Okay, so is that generalized spams or generalized? May I know in the comments? This is really confusing, because as I already mentioned, you don't have to, according to the recent updations, you don't have to repeat your answers. So whether it is generalized spams or generalized, what is your answer? Tell me. Okay, you can not tell me, actually you can comment. You can comment here whether it is generalized spams or generalized. Okay, everyone messaged generalized spams. So that's my doubt, whether it is generalized or generalized spams. Any idea? Now you guys are confused, right? Just guess what it will be. And yeah, it is from text B. I'll show you the answer. Okay, and it is mentioned here. Second last para. Progression is a word. Keyword from the question. Tetanus results in repeated painful seizure. Then, like spams that last for several minutes, it is generalized spams. Answer is generalized spams. Very good, Mega. Which is mentioned what is exactly in the bracket, because that is a name. Okay, generalized spams. So that is not separable. That is the name of the spam, generalized spams. So you have to write generalized spam. Okay, very good. That is the correct answer. Yes. So all of you got the correct answer. Sorry, Karthika, it's not generalized here. It is generalized spams. That spams should be there because it is not separable. Okay. 10th one. Name of the bacteria which can engender tetanus. Okay, so name of the bacteria which can engender tetanus. So what is the correct answer here? 10th one. Bacteria, name, tetanus. So these are my keywords from 10th question. So what is the name of the bacteria? Okay, Monisha, your keywords bacteria and engender, right? Okay, so what about the name? It is Clostridium tetani. Very good. Very good. Okay, and which is mentioned here in text A. Okay, the bacterium that causes tetanus is called Clostridium tetani. The bacteria can survive in a dormant state in soil and animal feces. It is essentially shut down until it discovers a place to thrive. So that's called Clostridium tetani. Okay, so also you have to be careful about the spelling of tetani. Okay, it is T-E-T-A-N-I. Okay, so answer is Clostridium tetani. Okay, so 11th one, a lung infection caused by accidental inhalation of something into the lungs. So my keywords, infection, accidental, that something. Okay, something. So what is that something? A lung infection caused by accidental inhalation of something into the lungs. Okay, so something which means what? 11th one, a lung infection. So we just want to know the name of that particular infection, a lung infection. So what is that lung infection? It is pneumonia. Okay, But one difference, I mean, there is a slight change in the answer. It should be aspiration pneumonia, which is from text C. Answer should be in the bracket aspiration pneumonia. Okay, so yes, that should be aspiration pneumonia. Maybe a complication of generalized spasms, a lung infection caused by accidental inhaling something into the lungs. Exactly the same question. So answer should be aspiration pneumonia. Okay, so when there is a bracket, that bracket is always connected to the previous line. So what is the prior line? I mean, previous line. This is the previous line, right? A lung infection caused by. So answer is aspiration pneumonia, not pneumonia. Okay, I hope it is clear. Then, 12th one. Okay. So answers. Okay, Monisha, it's not pneumonia, dear. It is aspiration pneumonia. Okay. Okay, Adira, it is aspiration pneumonia. Okay, Megha. Prayag, oh, very good. Aspiration pneumonia. Okay, Reshma. Then Gina, Ashwati. Okay, Ashwati, it is aspiration pneumonia. Okay, Betty. Laisama, Rajesh, yes. Megha. Okay, Price, it is aspiration pneumonia. Okay. So, okay, Reba, it is aspiration pneumonia. Very good, very good. Correct answers. 12th one. Substitution tag for tetanus disease. Very simple question. What is an alternative name for this disease? That is simply, I can say like that. So substitution tag. So these are my keywords from the question. So what is another name? What is an alternate name for this disease? 12th one. Okay, any idea? Okay, so that is from, yes, it is text A and answer should be 𝐿𝐿𝐽. Okay, tetanus is commonly known as, so another alternative name or substitutional name for this particular disease condition, which is 𝐿𝐿𝐽. Okay, answer is 𝐿𝐿𝐽. Okay, Adira, substitution and tag tetanus. Very good. Those are your keywords. Very good. Okay, 𝐿𝐿𝐽. Okay, Tintu, Gina. Okay, Divya. So answer is 𝐿𝐿𝐽. Very good. Very good. Okay, so now we are moving to the 13th question. The prevalent kind of tetanus. Okay, so my key, very short question. Prevalent kind, the type. Then tetanus. So my keywords, prevalent kind. So what is a common type? Okay, any idea? It is, I think it is from text. Yeah, so what is your answer? Text. I mean, 13th question. Any idea? What is that prevalent kind of? Prevalent kind of, which means that common. Okay, very common, yeah, typical type of. Okay, very good, Reba. It is generalized tetanus. Okay, so answer should be generalized tetanus. See, the most common type of tetanus is called generalized tetanus. So answer is generalized tetanus. Very good. Direct answer, right? It is generalized tetanus. Okay, so all of you got the correct answer. Very good. It is generalized tetanus. Then the last one, the surgical intervention conducted to remove dead or infected tissue. Again, surgical intervention, which means comes under the treatment. So my keyword, surgical intervention and remove. Okay, so to remove dead or infected tissue, what is the surgical treatment that we are conducting? Okay, maybe from text D, not maybe. Yeah, from text D, because treatment. So what is the treatment here? So first bullet point, cleaning the wound to get rid of the source of the bacteria. In some cases, a surgical procedure called debridement is used to remove dead or infected tissue. So answer should be debridement. Yes, from text D. Very good, very good. Okay. So a lot of correct answers. Okay, Megha Charles, Reba Rijo, Monisha Sharath, Reshma Sajeev, Ashwati Binu, Laisama Rajesh, Gina Varghese, Atira Kunjumon, Kavita Balaji, Tintu Thomas, okay, Betty Matthew, Reba Lijo, okay, Praise Sibin, yes, Kartika, Megha Charles, yes, it is debridement. Very good, excellent. Okay, a lot of correct answers. So now we are moving to the last set of questions, which is 15 to 20, that can be called. Fill in the blanks. Okay, so same instructions, word or a short phrase. 15th one, the minor events that stimulate dash like a loud sound, physical touch, a draft or light can trigger severe spasms. So what is your answer here? Any idea? So my keywords from the question, which includes minor, then stimulates as well as trigger. Okay, minor, stimulate and trigger. So these are my keywords. So any idea? Okay, so stimulate, answer should be from, yes, signs and symptoms, I guess. So what is the correct answer here? So these severe spasms, okay, may be triggered by the minor events that stimulate the senses. So answer should be what? Senses. Okay, so it is the senses because article is mentioned here. Is that article mentioned in the question? Okay, is it mentioned, the article? So as you know, articles are very important, as I told you in the previous class. So answer should be the senses. Okay, yes. Okay, so stimulate the senses. So you have to write the article there, the senses. Okay, so 16th one. Yes, Megha, it is not mentioned. Very good, dear. So your answer should be the senses. Okay, so let me see your answers. Oh, sound is not audible. Is it audible? No? Okay. Okay, Prayag, is it audible for you now? Okay, I hope it is yes. Okay, Monisha, it is not senses, it is the senses. Okay. Okay, Reshma, the senses. Okay, Megha. Okay, Adira, it is the senses. Okay, okay, Riba, into yes, the senses. Yes, a lot of correct answers. Very good. 16th one, dash is administered to neutralize the toxins that the bacteria have created in your body. So dash is administered. Again, administered, which means what? We are using the medicine, treatment, managing the condition to neutralize the situation, toxins. So what is the correct answer? So it is from text D. We are using a medicine here. That is tetanus immune globulin. Okay, globulin. So that is TIG. You don't have to write that full form there. Already that abbreviation is mentioned. So you can write TIG. So answer should be TIG. Or you can write the abbreviation. Both are correct. Okay. So TIG should be the correct answer. 17th one. Life-threatening breathing problems can occur from tightening of the dash and muscle rigidity in the neck and abdomen. So what about that one? My keywords are rigidity, breathing as well as tightening. Okay, a lot of correct answers. TIG. Yes, Reba. Yes, Laizama. Yes, Monisha, Betty, Gina. Okay, Megha. It is TIG. Ashwati. Okay, is it vocal cords? Very good. It is vocal cords from which text? Text C. Okay, so breathing problems, life-threatening breathing problems can occur from the tightening of the vocal cords. So answer should be vocal cords. Okay, so answer is vocal cords. See, that is already mentioned in the question, which means that article, so you don't have to write it again. So answer is vocal cords. Very good. 18th one. As the cells are growing and dividing, they release a toxin called dash that impairs the nerves which controls muscles. Okay, so what about that one? 18th. So my keywords: growing, dividing, release. Okay, so 18th one. Any idea? So what is the correct answer there? 18th one. Any idea? 18th question. Okay. Yeah, so that is from text A. Answer should be, okay, so that is from text A. Answer should be tetanospasmin. Very good. Okay, answer should be tetanospasmin from text A. It is called, see, growing, dividing, release toxins, which is called